I'm Dr. Kelsey Brenner. I'm one of the lead clinicians here at Neurologic Wellness Institute. I practice clinical neuroscience, and I also received my health coach training through Duke Integrative Medicine. I specialize in QEEG assessments and neurofeedback, and I mostly work with adults and children with mild traumatic brain injuries, ADHD, anxiety disorders, various neurological conditions, and that's what we specialize here. I was exposed to clinical neuroscience after interning under Dr. Ted Carrick in Atlanta, Georgia. And through that, I was exposed to hundreds of different patients with varying different neurological disorders. I learned under some of the best different doctors that could travel from all around the world. And through that experience, I was able to see kind of another approach to different neurological conditions that I wasn't exposed to prior to that. And based off of that, I was hooked after that. Clinical neuroscience takes the evidence-based research on all different types of neurological therapies and applies that into clinical practice. So we address the whole nervous system. Our initial evaluation is about 3 hours long. We look at cognition, visual perception, balance, all different areas of the nervous system to see how well they're performing. Based off of that evaluation, we can then see which areas are working really well and which areas need a little bit of improvement. Our therapies are designed based off of that evaluation. So every person gets a very unique treatment approach designed to strengthen those areas that may be a little weak. So clinical neuroscience really focuses on the root cause of a problem, and we often hear that everyone's looking for the root cause. But when you look at a condition, there can be varying symptoms. When you focus just on those symptoms, you may not be really looking at exactly what's causing those symptoms. For example, if you look at stroke or maybe a child with cerebral palsy, they could have a very spastic limb. Say their arm is stuck in a certain position, and it may look like the muscle's causing that problem, but really it's the brain that's not giving the correct signal to that muscle. So you can stretch that muscle all day long, but if you don't address the root cause, which is a brain issue, then you're only going to get so far. I first learned about micronutrients at a conference when I heard Bonnie Kaplan speak. She spoke about her research with micronutrients, working with different patient populations through brain development, but then also through different mood disorders. And it was super interesting and also just made complete sense. Micronutrients are the basis of so many systems in our body, and we need that to become healthy. A lot of times our food sources aren't very nutritionally dense. And so focusing on a very high quality micronutrient to help supplement that, you can get great results with patients. I was first exposed to Hardy's Daily Essential Nutrients after learning about them through a conference through Bonnie Kaplan. I was looking through just general micronutrients, and Hardy's was the ones that had the best research behind them. And like with anything, I like to try it on myself first before I give it to my patients. And so I started taking them and saw great results. I was in graduate school at the time, very emotionally, mentally just drained, working really hard, and I could eat all the nutrients through my food as much as I could, but I really wasn't getting what I needed. And so through taking Hardy's, I saw great results. Mental clarity, emotional stability, just could kind of handle my workload a lot better, and I realized that would be great for my patients as well. I always like to focus on lifestyle factors first with my patients. Making sure that their stress levels are down, trying to get nutrients from food as best as they can. But multiple factors kind of limit that. Our food supply isn't as nutrient dense as it should be. And also incorporating really healthy foods can be very difficult for patients, especially if they haven't done that in their life before. And so oftentimes we need to resort to a micronutrient such as Hardy's to really supplement that and bring them back to where they need to be. Patients have experienced a wide variety of changes using daily essential nutrients. I would say the biggest ones would be mental clarity and emotional stability. No matter what they come in with, whether it be a mild traumatic brain injury or children with ADHD, anxiety, a lot of times there's an instability there. They feel a lot of brain fog, difficulty focusing, and a lot of times emotional instability as well. By giving these micronutrients, they're able to resupply and supplement with what they need for their vital functions in their body. And the biggest feedback we get is just mental clarity, calmness, and emotional stability. When patients first start taking micronutrients, they may notice some changes right away. I often like to say that it may take a few weeks, and research shows it could take up to about 8 weeks of consistently taking them to see larger results. But they usually notice changes in mental clarity, just feeling like they have more energy, and better emotional stability as well. The most common symptoms that we recommend using micronutrients for would be brain fog, anxiety, different mood disorders, and a lot of times with children with ADHD, those micronutrients are a big piece of the puzzle that they're missing. My patients who have made lifestyle factors and have also incorporated these micronutrients into their daily lives, I've noticed that the results that we get with our therapies here in the clinic just last a little bit longer. They come on sooner, and they just feel more stable. They're able to think clearer. They can interact with their families better. They can go to Thanksgiving and family holidays and not feel very overwhelmed because they have the nutrients that they need to get through it. They're not getting too fatigued. And so we do see that, and we see just better and faster results with that. When looking at any type of supplementation, I always want to look at the quality. And so when I started looking into micronutrients, I wanted the best quality. Hardy's micronutrients have the best research out there. They've really been shown to have a big impact, and they're very bioavailable. So you want the patient to be able to actually use the supplement that they're taking. Oftentimes patients can pick up a supplement from anywhere in the store and they're actually not absorbing those nutrients. The research has shown that Hardy's micronutrients has great bioavailability and can be absorbed for the patient, and so that's the best quality that we can give to them.